Good day. Good morning, students. My name is Maxim Bukov, and let's start first lecture in your new circle, which will be about dentistry. And our first lecture will be we will talk about subject and problems of stomatology, about history of development of stomatology, its basics, problems, and value for the doctors of a general structure, general practitioner, questions of prophylactics, medical examination, and preventive maintenance of stomatologic diseases, illness of tooth, caries, its etiology, pathogenesis, preventive maintenance, and pulpits. As you can see the plan of lecture, first we will talk about history of occurrence and development of stomatology. We will talk about hygiene of oral cavity, and we will talk about several diseases such as caries and pulpits, about its etiology, pathogenesis, clinics, diagnostics, and about its treatment. History of dentistry, it's very interesting. You know that stomatology is the youngest section of medicine, but it's occurred even, I don't know, when the first people lost their first tooth. And its occurrence was preceded with a huge historical wave of development of two directions: maxillofacial surgery and dental treatment. 2500 BC before Christ in ancient Egypt treated a teeth. Heated metal rope burned out the dental pulp, and to release of toothache applied a various anesthetizing vegetable substance. The same in China, India, Syria. People used various means basically directed to struggle against a toothache. Hippocrates, for struggle against a toothache, used bloodletting, laxative emitting means, localized pepper, and alum. In the middle of century, dental treatment was outside of medical science and was destiny of handicraftsmen. Until the middle of 19th century, most dental operations were performed by traveling tooth growers and barbers, and the most common operation was tooth extraction. In the beginning of 19th century, rapprochement dental treatment with the science is marked. Dental surgery school where Dr. Taft have appeared. Same in Middle Age in Russia starts development of dentistry, and appear when was typed first books. The first book in Russia is issued in 1829 and referred to dentica or oral of dental surgery arts with treatment of dental illness with appliance of children's hygiene. After Alexei Sobolev, first Russian author who works on program of dental treatment. So in 1856, Zabolotsky write about illness of mouth, the science, and in 1880 Professor Sklifosovsky write a science work about durability of teeth at inhabitants of capital, Saint Petersburg. Uh, uh, in other parts of stomatology, maxillofacial surgery, the source of maxillofacial surgery to live in antique. For example, in ancient Tibet carried out the first operation on a person. It was about 3000 years BC, where so as you know, in India, for criminals, cut the nose so people can see that it's criminal. So after several times, criminals can become rich people, and they decide to make way more beautiful. As a result, was born the Indian way of nose plastic. We use a skin tape from the forehead. However, maxillofacial surgery has been closely connected to general surgery. In Russia, so in our country, the first resection of bottom jaw was made by Paul, having begun active surgery of maxillofacial area, and further were general surgeries that promote rapprochement of interest of surgery and dental treatment took part in perfection of maxillofacial surgery, and has caused occurrence of such a specialty as stomatology. It has taken place in 20 years of 20th century. Um, but at that time, the dentist did not have a theoretical base of occurrence of illness and scientific explanation of way occurrence. Today, the dentist, like a doctor, is a highly trained person whose work is vital to the health of a community. And dentistry today is a branch of medicine concerned with diagnosing, preventing, and treating diseases and abnormality of the tooth and gums. Professional training of dentists lasts several years. For the first 2 years, most student dentists undergo general medical training. They also study subjects such as anatomy, they study structure of body. Physiology, it's about how body works. Biochemistry, the chemical reaction of the body. And also we study a special anatomy and physiology concerning the structure of the mouth and teeth, how the teeth grow and how they become unhealthy or diseased. So you know by word that it's easy to prevent illness when treated. It's completely applicable to stomatology. And for example, huge complication cause of inflammation of wisdom teeth can be mediastinitis. Even simple dental caries can be cause of phlegmons or maxillofacial area. Today there are 4 units or subjects of stomatology, such as restorative stomatology, surgical stomatology, orthopedic stomatology, and pediatric stomatology or pedodontics. Restorative stomatology or therapeutic stomatology studies illness of the tooth and mucous membrane oral cavity and methods of way treatment. Surgical stomatology studies surgical illness of maxillofacial area. Orthopedic stomatology studies methods of prosthetics of defect dentition systems. And pediatric stomatology studies specificity of disease of maxillofacial area and the teeth at children and methods of way treatment. One of the major criteria of condition of body and oral cavity at definition of level of health is a condition of hygiene of oral cavity. As the basic parameters of hygiene definition of quantity is used a soft dental plaque, dental tartar, and pellicle. A process of way accumulation depends on autopurification, where irritants in plaque inflame the gums, making them tender and easily bleeding. Unremoved plaque hardens and collects under the gum line, making plaque removal more difficult. More plaque forms, further irritating the gums and making them red, swollen, tender, bleeding, and this condition we know as gingivitis, and can be controlled by scrupulous oral hygiene and by professional cleaning. If gingivitis is not treated, it develops into periodontitis. In periodontitis, the irritated gums pull away from the tooth, forming pockets between the teeth and gums that fill with bacteria and gradually deepen. When that happens, surgery may be needed to save the tooth. If left untreated, the bone supporting the teeth is destroyed, and the teeth begin to shift and loosen. Eventually, they fall out and must be extracted. So we will talk about dental caries and pulpits, and it's probably the most common of all diseases, highly developed in country. All group of population can suffer from a tooth decay. The main cause of dental caries are poor oral hygiene, character of nutrition, temperature of the food, and the physiological state of body. Um, let's give definition for dental caries. Dental caries is a disease of calcified tissue of the teeth caused by action of microorganisms on fermentable carbohydrates, and it's characterized by demineralization of the mineral portion of enamel and dentine, followed by disintegration of the organic material. As the disease approaches the pulp, it produces changes in the form of reactionary dentine and pulpites, and possibly giving pain. The main result in bacterial invasion and death of the pulp. The infected necrotic pulp when produce further changes in periapical tissue. On the other hand, the disease can be arrested in its early stage. We have four stages of dental caries: the spot caries, surface caries, middle caries, and deep caries. The spot caries localized on enamel and there's only discoloration of enamel. When become a hole, when you can see a hole, if it's localized only on enamel, we can talk about surface caries. If we're all demineralization localized in dentine, we talk about middle caries. And if it's on a border between pulp and dentine, in deep layer of dentine, we call such caries as deep caries. So, as I said, on the other hand, the disease can be arrested in its early stage since it's possible for remineralization to occur. In addition, progress of this disease to clinical cavity is not inevitable. It can be completely prevented by relatively simple measures. Um, we will talk about etiology of caries. Four factors are necessary to produce dental caries. It's dental plaque, suitable carbohydrate, it's usually sugar, susceptible tooth surface, and time. As I said, on the initial stage, on spot caries, surface caries, uh, unfortunately, caries presents symptomatically at relatively late stage. The patient may feel a hole in a tooth with a tongue, brown or black discoloration or cavity, but they didn't feel the pain. Caries even indentation is not painful, but cavitation may occasionally cause of mild pain with sweet things or with heat or cold stimuli. Normally, the enamel and necrotic dentine insulate the sensitive dentine and pulp from this stimuli. However, a much more common cause of pain, which may be intense, is pulpitis, which occurs late in the development of caries lesion when caries is very close to pulp or actually exposed. There are four approaches to management of caries. We can attempt to arrest the disease by preventive measures. We can remove and preventive measures you can use only when your car is in a spot stage. If we already have a cavity on the tooth, you have to use other management to remove and replace your caries tissue. You can use a combination of these two approach, and you can extract the tooth. It's most dramatically outcome. Early diagnosis of a caries lesion has become even more important since the realization of the caries is not simply a process of demineralization, but an alternating process of destruction and repair. So, saliva is excellent remineralizing fluids, and the balance can be typed in favor of repair by modifying diets, careful use of fluoride, and removal of plaques. If caries left untreated, microorganisms can gain entrance into the pulp and can cause its inflammation. Inflammation of pulp we call pulpitis. During pulpitis, teeth are sensitive to the chemical, mechanical, and thermal stimuli. Spontaneous severe pain are the most characterizing symptoms of pulpitis, usually at the night. The pain may spread over the jaw, ear, or temple. They may be very severe and last for a long time. Pulpites may result in gangrene of a pulp and its decomposition. Treatment of pulpites must be consist in modification and removal of a pulp tissue and filling it too. Pulpites may be painful or painless, but even the painless form may become painful in response to certain stimuli. For example, the tooth with painless pulpite may become painful when percussed, or may be produce prolonged pain in response to electrical or thermal stimuli. Usually for cold, pulpites may produce spontaneous pain, which may be very severe. It does not always develop from caries. Pulpites may be result from a trauma, internal resorption, or another etiology. Apparently, pulpites from caries is reversible until the pulp is invaded by microorganisms. It's reversible when depends on the number and virulence of microorganisms and on therapy. Following invasion of the pulp by microorganisms, a prognosis for prolonged pulp viability is poor. There are, as I said, two types of pulpites. Irreversible pulpites, when continues to progress at varying rates for the pulp chamber and along the root channel. This progression leaves the contents of the pulp chamber necrotic or filled with a pus and unable to respond to electrical or thermal stimuli. As the disease process passed through the apical foramina, it became apical periodontitis. Reversible pulpitis is treated by sedative dressing, while irreversible pulpitis is managed with endodontic therapy or extraction of a tooth. What can do general practitioner? You as a physician can give first aids independent of the cause of dental pain. Treatment possibility includes systematic analgesics and antimicrobial, local treatment, local anesthetics, or combination of these. General physician can treat pain and inflammation after dental extraction or operation, but you have to do it only when consultation with the dentist is not possible. All over cases should be referred to a dentist after treatment in an acute phase. So thank you. That's all that I want to tell you about history of dentistry, about its development, its units, about oral hygiene, about dental caries and pulpites. See you on my classes.